follow-up story tonight about the new International Adoption Clinic at U of L.
In fact, so many people are using the clinic. It's about to expand, but also tonight, the family we featured in that first story has actually since grown, and medical reporter Lori Lyle explains a trip back to the clinic filled with relief.
Yes, lots of relief. We got to meet their new little addition. What a sweetie. We met Sarah and Chris Stewart last summer while still waiting for word from Ethiopia to pick up their baby girl. They got Addie just before Christmas, and we were there for her first visit to the clinic that helped the Stewarts prepare for the homecoming. Looking straight into our camera, Addie's vision is even better than her brand new parents anticipated. Before Sarah and Chris actually met her,
she's able to find the little toy and reach for it.
They first met with pediatrician Mike Howard at U of L's International Adoption Clinic, a requirement to complete the adoption process, and at the time, a videotape and minimal medical records were all they had to go on. But Dr. Howard was able to calm major concerns.
Probably just minor correctable.
With surgery, he thought, and in this, Dr. Howard's first in-person exam.
And she obviously has a degree of deviation here.
He's relieved too. His assessment was right.
The good news is she does track. She follows our vision.
Just as the stewards followed their hearts, never a hesitation.
And that was a good thing that they did that they prepared us that way, so we would be ready for all outcomes.
And one of the best so far.
The special ladies there, her mother's there, were cajoling her to say, "Daddy, Daddy." And of course, that's the first thing she said to me, so it was good to go from there.
Saying just a few words, her speech is seemingly the only delay, though Dr. Howard warns institutionalized kids can face some huge learning curves.
We weren't sure she was walking, so to see her walk and talk was pretty amazing.
Addie is about as typical as a 2-year-old can be.
Oh my goodness!
They'll do extensive blood work, hepatitis, HIV, parasites, lead.
We do lead levels because in developing countries, lead levels tend to be higher.
But on the surface, Addie's medical outcome is promising, and her promise of a loving family fulfilled.
It just seems like she's been there the whole time. I knew she was ours.
With more than 1,000 international adoptions a year to parents in Kentuckiana, the new clinic at U of L is staying booked. People are traveling from across the state, Indiana, even Illinois, to see the team of doctors available. The clinic will extend hours soon, they say in the spring, and hopefully be able to service all those who need them.
They better have their running shoes on.
Yeah.
That's such rewarding work, too. It's nice to see.
Right. And it's needed in our area, the first one here.
All right.
Thanks, Lori. We'll be right back.